Next question. A person after road traffic accident operated of hip fracture. Patient was shifted to ICU. Now patient develops suspiciousness over family member that they want to kill me. They want to take my property. Yes. This is delusion of persecution. Delusion of persecution means somebody wants to harm me. Patient also visualize snakes on floor. Visual hallucination. So first question, visual hallucination. If any question you find, you will suspect organicity. Organicity. Question has been asked in FMG that which of the following symptoms does not suggest organicity? Yes, auditory hallucination. Usually found in psychiatric disorders, most of the psychiatric disorder, but visual hallucination suggests organicity. So auditory hallucination, question has been asked in psychiatry, most common hallucination is auditory hallucination. So psychiatric disorder. So in this question, delusion is there, visual hallucination is there. If these symptoms are present, you will say acute psychosis. Till now, if they don't give this line, then the answer would be acute psychosis. But in the same question, if they added that patient is not oriented to time, place, person, appears confused, means in any question if you find acute confusional state or disorientation, acute disorientation, or drowsiness, or clouding of consciousness, the diagnosis would be delirium. Point it out. In any question you find that there is acute confusional state, disorientation, drowsiness, clouding of consciousness, then the answer would be delirium. In the same question, if they say that these symptoms appear and patient was taking alcohol for last 15 years, 10 years, now he stopped taking alcohol, then it would be delirium tremens, alcohol withdrawal. Okay, and in this there would be these symptoms plus autonomic symptoms just like tremors would be there. Got the point? So I have told you multiple questions on the same way. Yes, if this question is there and till now acute psychosis, they added one more thing, delirium, they added one more thing, that alcohol, history of alcohol plus tremors, then it is delirium tremens. Okay. This question FMG previously asked question, after 72 hours of stopping alcohol use, patient with alcohol dependence will produce, yes, present with, you know, tremors. If a person is taking alcohol for such a long time, 10 years, 15 years, now he stopped taking alcohol, in the morning he would have tremors. He took last intake in night, now wake up in the morning and started having tremors. That is most common question has been asked, or earliest. Both questions are there. Seizures within 24 hours, around 24 hours. Delirium tremens, D matlab die, T matlab try. 2 days to 3 days, means 48 hours to 72 hours. Although this duration is not fixed, but question has been asked in FMG, so you will remember, yes, around 72 hours delirium tremens. So this is not fixed, but questions are asked. Now, in alcohol dependence, okay, substance is very important. Every time you will find one question from substance. So detoxification means if a patient is taking alcohol, we want to reduce withdrawal symptom. Which drug we will give? We will give benzodiazepine, long-acting benzodiazepine, chlordiazepoxide is drug of choice. But in question, you will find that patient is taking alcohol for 10-15 years, now came to your emergency and your liver function test machine is not working. Yes, you know, alcohol will lead to liver dysfunction. So if liver is not working properly, then we will prefer short-acting benzodiazepine. So if question is asked, liver function test machine is not working, then preferred drug is lorazepam, okay, or oxazepam. Or if you are sitting in periphery, lab facility is not there, which drug you will prefer? Definitely lorazepam, oxazepam, okay. Very good evening. Please explain about brief psychotic episode and schizoaffective disorder. Let me discuss. Brief psychotic disorder, I just told you. In brief psychotic disorder, one symptom should be there out of these. One symptom should be there for one symptom for 1 month to 1 day to 1 month. Okay, to be more precise. Or simply you can say one symptom is sufficient to make the diagnosis of brief psychotic disorder, okay, for less than 1 month. This is brief psychotic disorder, okay. Now, schizoaffective, I will explain schizoaffective like this. Suppose a person is having delusion hallucination for 6 months. And a patient is having depressive symptoms for 5.5 months. Depressive symptoms and delusion and hallucination for 6 months. Means he is having schizophrenic symptom, he is having affective symptoms for most of the duration of illness. Means out of 6 months, 5.5 months is having both schizophrenic symptom and depressive symptom. This is schizoaffective disorder. Okay. Good evening, dear. So, is it clear? Now, you can give me answer. A patient with history of chronic alcohol use was admitted and operated for acute appendicitis. Yes. After the surgery, patient appeared confused. Yes, confused. What is the answer? Confused means delirium. History of alcohol means delirium tremens. Okay. Suspect family member that they want to kill me and report seeing snakes in the wardroom, means visual hallucinations are there. So answer is yes, delirium tremens. Got the point? Now, Wernicke's encephalopathy question has been asked so many times. Wernicke's, pneumonitis, Goa, global confusion, ophthalmoplasia, ataxia. Question has been asked that in Wernicke's encephalopathy, lesion at mammillary body. Mammillary body. Mnemonic W, उल्टा कर दोगे M. What is the treatment? Alcohol से related जितने भी disorder हैं, उनमें treatment क्या होगा? थायमीन. सो इसमें हाई डोज आईवी थायमीन. यहीं पे हम डिस्कस करेंगे ट्रीटमेंट ऑफ डिलीरियम एंड ट्रीटमेंट ऑफ डिलीरियम ट्रेमंस. डिलीरियम, yes, another name is ICU psychosis. तो treatment would be low dose antipsychotics. Delirium tremens, yes, delirium tremens, we will give IV lorazepam plus IV thiamine plus IV dextrose. This question has been asked. We will give dextrose after thiamine. Dextrose हम thiamine के बाद देंगे. क्यों देंगे? क्योंकि dextrose utilize thiamine. डेक्सट्रोज मेटाबॉलिज्म हमने मेडिसिन में पढ़ा है और बायोकेमिस्ट्री में पढ़ा है कि डेक्सट्रोज के मेटाबॉलिज्म के लिए थायमीन की जरूरत होती है एंड द पेशेंट ऑफ अल्कोहल डिपेंडेंस ऑलरेडी हैविंग थायमीन डिफिशिएंसी. सो इफ यू गिव डेक्सट्रोज फर्स्ट, द रिमेनिंग थायमीन would be utilized for dextrose and there would be acute precipitation of thiamine deficiency. So क्या करते हैं हम? पहले lorazepam, then thiamine, then dextrose. Okay. Korsakoff syndrome. This is a chronic complication. In this, anterograde amnesia and retrograde amnesia both are there, but more anterograde amnesia. One question was asked, in Korsakoff syndrome, there is no hallucination. Actually, sometimes you will find the word Korsakoff psychosis. Actually, it is not psychosis. So no hallucination. In this, confabulations are there. Confabulation means filling the gap, filling the memory gap by false story, false story. That is confabulation. Treatment is oral thiamine. Okay. Yes, Wernicke's cephalopathy, IV thiamine, high dose. Korsakoff, oral thiamine. Yes, tobacco, yes, cigarette smoking, anti-craving drug, varenicline and bupropion. Both questions are asked. If one question is asked that which is better, so varenicline is better than bupropion. Varenicline may produce suicidal thought. Bupropion, it is NDRI, norepinephrine dopamine reuptake inhibitor. This is antidepressant. So question has been asked which anti-craving for cigarette smoking is having antidepressant activity. Yes, that is bupropion. Clear?